Welcome to Ulosca channel. Access all nursing practice questions. Pediatrics nursing practice questions with answers.
Question 1. At what age should a child receive their first flu vaccine? A. 6 months. B. 12 months. C. 2 years. D. 3 years. Which one is the correct answer? The correct answer is A. 6 months. Explanation. The first flu vaccine is typically given at 6 months of age to ensure early protection. Question 2. Which of the following is a common sign of infant colic? A. Excessive crying for more than 3 hours a day. B. Constant smiling and cooing. C. Difficulty feeding due to constant sleepiness. D. High fever and vomiting. Which one is the correct answer? The correct answer is A. Excessive crying for more than 3 hours a day. Explanation. Excessive crying lasting more than 3 hours a day is a hallmark symptom of infant colic. Question 3. What is the primary concern when a child is diagnosed with asthma? A. Risk of anaphylaxis. B. Risk of respiratory infections. C. Risk of airway obstruction. D. Risk of dehydration. Which one is the correct answer? The correct answer is C. Risk of airway obstruction. Explanation. Airway obstruction is the main concern in asthma, which can lead to difficulty breathing and reduced oxygen levels. Question 4. What is the primary method of preventing sudden infant death syndrome? A. Feeding the baby formula only. B. Placing the baby on their back to sleep. C. Keeping the baby in a crib with pillows. D. Avoiding breastfeeding. Which one is the correct answer? The correct answer is B. Placing the baby on their back to sleep. Explanation. Placing the baby on their back to sleep significantly reduces the risk of SIDS by preventing suffocation. Question 5. Which of the following is the most common cause of diarrhea in infants? A. Bacterial infections. B. Food allergies. C. Viral infections. D. Dehydration. Which one is the correct answer? The correct answer is C. Viral infections. Explanation. Viral infections are the most common cause of diarrhea in infants, such as the rotavirus. Question 6. At what age is it recommended to introduce solid foods to an infant? A. 2 to 3 months. B. 4 to 6 months. C. 8 to 10 months. D. 12 months. Which one is the correct answer? The correct answer is B. 4 to 6 months. Explanation. Solid foods are typically introduced between 4 to 6 months of age when the baby's digestive system is ready. Question 7. What is the primary goal of treatment for a child with croup? A. Treating the infection with antibiotics. B. Reducing inflammation and improving airflow. C. Administering a pain reliever. D. Preventing dehydration. Which one is the correct answer? The correct answer is B. Reducing inflammation and improving airflow. Explanation. The goal for croup is to reduce inflammation in the airways and improve airflow, often with corticosteroids. Question 8. Which of the following vaccines is recommended at 2 months of age? A. Hepatitis B. B. Diphtheria, tetanus, pertussis. C. Measles, mumps, rubella. D. Influenza. Which one is the correct answer? The correct answer is B. Diphtheria, tetanus, pertussis. Explanation: at 2 months, infants receive their first diphtheria, tetanus, pertussis vaccine as part of routine immunization. Question 9. What is a common side effect of the varicella vaccine? A. Vomiting. B. Mild rash. C. Swelling of the lymph nodes. D. Severe pain at the injection site. Which one is the correct answer? The correct answer is B. Mild rash. Explanation: a mild rash is a common side effect of the varicella vaccine. Question 10. Which of the following is a sign of dehydration in toddlers? A. Soft fontanelles. B. Sunken eyes and dry mouth. C. Increased urine output. D. Pale skin and increased appetite. Which one is the correct answer? The correct answer is B. Sunken eyes and dry mouth. Explanation: sunken eyes and dry mouth are clear signs of dehydration in toddlers, indicating fluid loss.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.